So, good evening, everyone. Mr. Chari, you want to say something?
No. You can set the context and go.
Yeah. Thank you. Okay, so good evening, everyone, and thank you for joining for the session today. Today, we will dedicate our time to understanding monitoring, evaluation, and learning. Basically, we are going to focus on how do you ensure that you define your program results and you measure them. Because when we are talking about monitoring and evaluation, we are speaking about ensuring that we achieve the program results set out. So it is like an accountability mechanism to ensure and to report that the activities are being delivered as planned. And it is also used for learning and adaptive planning. So if you had planned to achieve a result, an indicator of success, and if that indicator of success is not being achieved, an outcome is not being achieved, then what is the learning out of it? How do you adapt the program to ensure that you achieve the outcomes? And this, when we say that these outcomes are for what, these outcomes could be to meet, to report to the community, it could be to report to a funder, it could be to report to government, and it could be to monitor the program outcomes to ensure sustainability. So today's session, we have divided it essentially into two parts. First half an hour, we will look at case studies from Telangana as to how it has established an important monitoring system, a state-level monitoring system to ensure that the operation and maintenance of the public toilets across the state is being monitored twice a week and being done extremely well, and all the 144 ULBs, 142 ULBs participate in this process weekly twice to see that the public toilets are maintained well. And you all have raised this issue that maintenance of public toilets is a big issue. So Jyotsna would be taking you through that. She would also be sharing some insights as to how it is being implemented and how it is being extended. After Jyotsna, Professor Chari would be speaking to you about incorporating containment related requirements as well as dimensions as part of building plan. And this is also taken up in Telangana, first of its kind initiative as an online system as part of the auto DCR system. And Professor Chari would be sharing these aspects with you. After that, we have members from Athena who have been working and supporting citywide inclusive sanitation and cities across the world, not just India, in developing the indicators. So we have learned so much, but what are the indicators which you will measure continuously, which will tell you that you are moving towards becoming a CWIS city? What are some of the tools and frameworks which you can use to do this monitoring? And how are these tools and the results reflected for you to be able to share it with your colleagues and funders and government partners to be able to think through and make some changes in the program so that the results are achieved? So this is the context for today's session. And with that, I invite Jyotsna to share her presentation and share her experiences.
Thank you so much, ma'am. Share my screen. Yeah, I hope my screen is visible to everyone. Yes. So yeah. So good evening, everyone. So today we are going to learn about some of the tools which have been developed by Government of Telangana for tracking the progress of sanitation related services. So the first one is the toilet monitoring system. So firstly, Telangana government believes that monitoring is key for sustaining any of the facilities in the state. So, so before going into the system, so just a brief of why it was developed. So the government of Telangana has issued a directive to all the ULBs to construct 1 toilet seat per 1,000 population. So this is in line with the national guidelines. So with this directive, there was a huge construction of public toilets, community toilets in the state. So as part of this initiative, like more than 5,000 seats were constructed in the state. So while this well-designed infrastructure is being constructed, so it is equally important that these facilities are equally monitored, these facilities are operated and maintained properly. So in light of this, the state has decided to develop a real-time monitoring system, which is called as a Pattana Pragati Toilet Monitoring System, so which will track the progress of these services in the city, in all the cities. So it helps the it helps the state administrators and also ULB level officials to track the progress on how the toilets are, what is the quality, and also the sustainability of these facilities. So getting into the system, so it is basically a 3-part system. So the first one being the web portal, where the information of the toilet is collected, and the second part being the mobile app, which is used for monitoring the toilet on the operations, how are they maintained and all. And the third part is the dashboard, so which has the information of all the toilets and which is used by the administrators for decision making. So I'll be explaining each of this part in detail. So this was launched in two phases. The first phase was the web portal. So here all the ULBs have entered detailed information on the toilet infrastructure. So it includes the design of the toilet and also the status of the operations and maintenance. So this is the screenshot of the web portal. So all the toilets present in the ULB are listed here. So we also captured different typologies of toilet, like whether it be a public toilet, community toilet, or even a fuel station toilet. So we are capturing all the different typologies, and also this different status in which the toilet is, like if it is a functional toilet or under construction or planned. The reason considering the under construction and planned is that to make sure that all the facilities are being planned in the toilets, like even in the under construction toilets, whether all the infrastructure required for a public toilet are present or not. So that is the reason we have also included this under construction and plan. So this web portal includes a set of 25 questions which have been adopted from the SBM guidelines and other national level guidelines. So it includes all end-to-end toilet infrastructure information, like details of operation and maintenance, whether there is a valid contract or who is the operating agency, what is the status, who is the caretaker, and also who's the sanitation inspector who will be monitoring the toilet, and other infrastructure details such as handrail, ramp, or whether there is a separate entrance for men and women, whether it's child friendly, what is the containment system, and all the infrastructure services. And also in light of the COVID, we have also included questions related to availability of hand sanitizer and PPE for caretakers and cleaners. So these are the set of questions which are included in the web portal, which will be filled by all the ULBs in the first phase. So coming to the second phase, we have launched the mobile app for monitoring. So this includes questions related to the operations of the toilet. So this has a set of 18 well-defined indicators, again adopted from the national level guidelines. So these questions are mainly focused on day-to-day operations, like how is the toilet maintained, whether it's clean or not, whether there's a foul smell, or availability of water supply, like continuous water supply, and if there is any monitoring system in place. So all these monitoring related information are captured through this mobile app. So sanitary inspector of the ULB visits the toilet every twice a week, and then he takes the photographs of the toilet and upload the information related to the operations of the toilet. And the third part being the real-time data analytic dashboard. So here all the information which is collected from the web portal and also the mobile app will be curated and analyzed and presented on this dashboard. So here we can see the overall status of the toilets in the state, like how many functional, how many under construction, and we can drill down to up to district level and also ULB level information as well. And also a separate column is given for the COVID-19 response, like availability of sanitizer and PPE as I spoke. So this has also been presented on the dashboard. Another key feature which is presented on the dashboard is the Cleanliness Index. So all the toilets which have been monitored by the sanitary inspector are evaluated into 3 categories, like whether it's good or whether the toilet needs improvement or it needs considerable improvement. So based on the feedback given by the sanitary inspector, if out of the 18 questions which have been answered, if 15 are correct, then they are categorized into good, and then below that will be need improvement and need considerable improvement. So this helps the ULB officials to take an action on the need considerable improvement, the red category toilets. So it helps in decision making. So another key feature of this system is that before launching this, we have trained the environmental engineers and the sanitary inspectors of every ULB. So the training has been done on the usage of the web portal and also the app. And additionally, a separate helpline number, a dedicated number is also launched for this, so that to help the sanitary inspectors and environmental engineers to do their job. And as I already told, mandatorily every week twice, like every Tuesday and every Friday, the sanitary inspectors visit the toilets and assess the maintenance of the toilets using photographs and by responding to the indicators. So on the impact, like it's been like a 1.5 years since this app has been launched, and we see the impact. All the ULBs have enthusiastically responded, and they are uploading the toilet information and also the monitoring related information. So if we see the status, on an average, like 85% of the toilets are being monitored twice a week, and about 100 plus ULBs are reviewing twice a week 100% of the toilets present in their towns. So this is a massive progress that we are seeing in the state, and periodic reviews are also being conducted under the chairpersonship of CDMA sir, and also ULB officials will be sent the report bi-weekly, like on both the review dates, the reports will be sent to the commissioners and other ULB officials. And also WhatsApp groups are extensively used to post the status, like on the every review day, the reports will be posted on the WhatsApp groups, and also the ULBs which have not done the reviews will be listed out separately, and the reasons will be taken. So even for appreciation and also for letting them know that they have not done the toilets, the WhatsApp groups are extensively used. And recently, the PPTMS also won a Digital Technology Sabha Award under the Enterprise Applications category, and it also been appreciated by several states and also by the national government. So moving forward, building on this, now the state is developing a system to capture the user feedback from this public sanitation facility. So the state is developing a citizen monitoring system. It is also a real-time digital system where the feedback from the users is captured on a real-time basis. So it's yet to be launched. It's actually ready for launch. So these are some of the screens which you can see from this citizen monitoring system. So it captures some basic feedback from the users, like their experience, whether the toilet is clean or not, whether it is safe, or whether there's a foul smell. So it has some quick 8 to 9 questions which the user can respond to. So this works based on a QR code. On every toilet, a QR code will be presented. So after the user, after he uses the toilet, he can scan the QR code and he can submit his feedback, and this will be captured on the dashboard. So there'll be a 2 level of monitoring being done, one by the ULB officials, the sanitary inspector visiting the toilet and monitoring, and also on the other hand will be receiving the feedback from the citizen, which also tells the functioning, how the toilets are being functional. So it's a 2-level system which has been working right now in the state. So moving forward, the state is also designing and also building on to develop an FSM tracker, which is again a real-time digital monitoring system to monitor the end-to-end services of the FSM value chain. So this also has 3 components. The first one being the like capturing the status of FSM reforms implementation. So reforms include whether it may be training done in the ULB, capacity building programs, and are related to desludging operators or related to containment system. So all these reforms related information will be captured and monitored in the component A. And in the component B, the status of the FSTP construction, like the state right now, it is going for construction of FSTPs in all the 142 towns. So the status will be captured here as part of the system. And after the completion, the operation and maintenance of these facilities will also be monitored, like the outlet parameters and inlet parameters will be captured and monitored through this system. So it's in the phase of designing. So the state is developing an system which like monitors the end-to-end services of the FSM in the overall, in all the ULBs. So this is about, yeah.
So this is interesting to note that, the state government essentially.
Ma'am, we cannot hear you.
Only your voice is.
I'm sorry, can you hear me now?
Yes, you can.
Sorry about it. I'll just switch off my video. So it's interesting to note that, while all the states as part of the ODF journey had implemented online systems to track the construction of individual household projects, Telangana took the step to move forward and look at how it could also monitor its ODF plus. It's ODF plus initiatives and is now moving towards ODF plus plus, monitoring of ODF plus plus, as Jyotsna had shown, which is the entire FSM value chain, looking at how many sanitation workers are empaneled, whether FSTPs are under construction, and all these elements are incorporated in it. As far as some questions on the chat box about
so Dr. voice is not clear.
President, can you take over? I'm having a little.
Yeah, I think I will take over.
Thank you.
So, Jyotsna, can you hear me?
Yes, sir. You can hear you.
So, just like to, this is important, and for some reason, Jyotsna was a little fast. I've been telling her to go slow. This is super important from all of us. We all know, especially those who are in the development sector, that monitoring is the most critical component, not just asset creation. While assets are created, institutionalized monitoring, not like a annual monitoring or a midterm reviews or third-party monitoring, those are important for identifying gaps post implementation and doing course correction. But what is important is to do a in-line real-time monitoring for ensuring that service delivery is maintained on a day-to-day basis, be it municipal solid waste management or public toilets, sanitation or water supply. So this particular initiative, as Jyotsna mentioned, is a very, very simple tool. In fact, this whole app costed about, if I remember, Jyotsna, is about 13 lakhs we charge, right? For the whole thing. It's about 12, 13 lakhs. Now, when crores of rupees of investment was made, and if you don't have a regular oversight on those investments, we cannot assure service delivery. Hence, this monitoring system, which is institutionalized within the state government at the DMA, at the additional collector, we have a position at district who looks after urban issues. Is called, he or she is called additional collector, and at the municipal commissioner. So there are 3 layers for monitoring. One is at the municipal commissioner level. Second is at the additional collector level, who is responsible for all urban and urban local bodies in that particular district. And then you have a commissioner and director of municipal administration who is responsible for the whole state from a sanitation point of view, but CDMA looks after many other things. The municipal administration director looks after, but this is one of the core functions. So what Josna has presented is very, very important, cost view. What they did, while construction is on, all the data is uploaded on the website. All the toilet infrastructure data, including fuel stations. Fuel stations में भी toilet होता है, because Ministry of Petroleum has mandated. वो भी data होना चाहिए. That is also public choice. So this whole database is created, including lat logs. उसका एक coding किया है. Now the question is, how do you periodically monitor it, and how do you ensure that these assets, each asset may cost about 7 to 10 lakhs. In Telangana in particular, Andhra and Telangana, many toilets are outsourced for maintenance. Municipalities outsource it for maintenance. So how do you ensure that these outsourced activities are well done to the desired service level standards? So now the role of municipality is a regulator and monitoring agency. So the sanitary inspector is assigned to each of the toilet. Her job or his job, every Tuesday and Friday, they will visit and they will assess the parameters. 5-6 parameter ज़्यादा नहीं. Smell है कि नहीं, lighting है कि नहीं, ventilation सही है या, you know, is there any visible improvement, visible problem, पानी है कि नहीं, soap है कि नहीं. These are routine monitoring things which are assessed and which will be fed in the mobile app. It gets aggregated. The data goes to the concerned commissioner. The data goes to the concerned collector, additional collector, and the aggregated data is monitored at the DMA level. There is one responsible officer. Mr. Shankar is there. Josna supports, and the data is monitored. And the same night, every Tuesday, every Friday, I get the data regularly. I see the data regularly. If the sanitary inspectors or municipalities are not reporting or not visiting the toilet infrastructure, it gets alerted. And CDMA is a part of this network, so they keep sending reminders. Then video conference में कभी उनका regular video conference में the names will be read out. The names of the cities and towns will be read out. उसके वजह से जो है peer pressure भी लगेगा and the monitoring system is effective. Honestly speaking, I have not seen, we have worked in a number of geographies, this sort of controlled regular monitoring और एक साल चला दिया, then I think things will stabilize. So I think this is one positive feature about it. Now, somebody asked a question, how do you know that whether sanitary inspector or sanitary jawan sahi data feed कर रहा है, घर में बैठ के कुछ कर रहा है? Because these are all geo-referenced. All the mobile applications are different. They can't goof up. Let's assume even if they goof up, that is where Josna has explained. Citizen also can give feedback. It is mandatory for the sanitary. It's a triangulation. ऐसा नहीं कि सब जगह पे 100% accuracy कहीं होता नहीं है, but it is a way of triangulating the data. So citizen का feedback और sanitary inspector का feedback जोड़ते हुए एक monitoring system बन जाएगा. Then over a period of time, it becomes a habit. So we are still new, and this has also been taken up in other parts of the state. In Andhra also, this is being administered. So I think Now the next stage is, as you can see on my screen, yesterday there was another FSTP was inaugurated in Adilabad. I have changed the screen just now. Yesterday there was inauguration of one more FSTP, MBBR technology. So now these 70 plus 140 FSTPs aane wale hai, uska pura monitoring karna bahut zaruri hai. Otherwise, anything can happen. It could be a garbage in, garbage out. So continuous monitoring of the outputs, progress, performance parameters, ये बहुत ही जरूरी है. और ये IT enable का इसका 5, इसका जो citizen monitoring is about 7 lakhs. ये जो पहले वाला monitoring जो public toilet monitoring for the whole state is about 13 lakhs. और FSTP का monitoring का पूरा integrate करते हुए उसका 8 lakhs का expenditure है, बस उतना ही. Now when we are spending hundreds of crores monitoring के लिए तो इतना बहुत ही जरूरी है और वो करना ही चाहिए. I think that is what we want to share with you, and I think it need not be only always at city level, state level. It can be done at the city level also. Malini, over to you.
Yeah, so just thank you very much, President Chari. I also want to reinforce the point that setting up a monitoring system, which is a real-time monitoring system, is really not expensive at all. But getting the state and city level officials to buy in and actually use the system is where the trick lies. So you may turn around and ask a question that given this elaborate monitoring system being operational for the last 1.5 years, would you find every toilet in Telangana, public toilet in Telangana, to be fresh and clean and sparkling? Maybe not. But the point is that over the last 1.5 years, a very robust system is established. Everybody is sensitized. People, ULBs which do not upload the data are taken to task by the highest level. Even the principal secretary uses the dashboard, and during their meetings, even with the collector meetings, this dashboard is brought in, and ULB wise, discussion is taken up. So this ownership of and this accountability at the state level is very important, and over time, definitely the quality would improve. And even now, the other day when we met the CDMA, he was saying that last year in ODF Plus, about 5 towns had received ODF Plus. This year, the number of towns which have received ODF Plus from Telangana is gone beyond 80. Which is a great achievement. From out of 140 towns, if 80 are receiving. So in that sense, we feel this is a great initiative. We'll be very happy to share all the details you want. It's easy to implement, and we will reach out to the indicators. And if you would like any state level presentations or anything, we'll be very happy to join the discussions.
Sujay Saab has a question.
Yeah, so I see 2 hands up. Mr. Sujay, please go on. Then we'll move to the next topic after this.
Yeah, thank you, Dr. Malini and Jyotsna. I think so actually speaking, I joined this ASCII course for this session you are showing today. This is what I was looking for, and this is what I really want to learn. The problem, the issue is for us here, monitoring, for the way I was thinking about it, is that a state level monitoring of an FSM system, state level monitoring of an FSM system, that is one. Then an urban local body level monitoring of the entire urban local body area of all the FSM systems there. Then a FSTP monitoring of functioning of a treatment plant. And then what becomes critical, going below that, what you have shown is very interesting, a monitoring of community complexes of public toilets. And lastly, going down to the household level, that how do you monitor the household level thing? This is something we are working with the JJM also, asking them to monitor down to the household level. So great, yeah. So the next request was to show the dashboard, and you are showing it. Over to you to explain. You can explain the dashboard. And one more question, Dr. Malini, is that, can you also explain, I think Professor Chari started to, who are the people who read this dashboard? And how is it, is there a kind of control room, or is there something that keeps on monitoring what is coming? Then only corrective action will happen. Yeah, over to you.
Yeah, so Sujayji and everyone else, the first part was updating the information. Each ULB will update the infrastructure information about the toilets. For that, access is available only to that concerned ULB. For part 2, which is the monitoring through mobile app, that access is given to the sanitary inspectors of the ULB. Whereas when it comes to the dashboard, there is no access required. It's an open dashboard. Anyone in the state, you can also, we will share the URL, you can also view it. But you can't make any changes in this, of course. And right now, this is being used for monitoring by the state level official, Mr. Shankaraya, who was actually part of cohort 1, and we have developed this in consultation with him. And it is shown to CDMA, it is shown to Principal Secretary, it is shown to the district collectors during the meeting. So it is seen, it can be seen by everyone. And if you just scroll down, if you see this on the top, while it is automatically showing the entire state's data, there is a drop down where you can see ULB wise also. So here you can pick up any ULB. And you will see that the entire information has changed now. Just go to the top, Jyotsna, at the top. Yeah, so you can see here the information is changing, and this is real time for the last update. So today we are on Wednesday. The last update was yesterday. Is the grievance addresses? There is a number, as Jyotsna said, which is essentially for ULBs to reach out. Each of the toilets has a service level displayed, which has a grievance redressal number, which is enclosed. But it's not integrated into this system. So how many complaints received, how many addressed, if that's what you're asking, Ms. Kaushiki, it's not integrated into this system, but they have some other systems, which is overall grievance for the ULB. So you can go down till the ward level also here. You know, it's very easy.
Ward level as well as toilet level.
Yeah, even individual toilet level, you can go. If there are specific wards where you can use this for performance appraisal of the sanitary inspectors. In fact, last August, some of the sanitary inspectors who have 100% updating the information, they were felicitated. You can use it for felicitating the best PPP operator, best SLF. So there are various ways in which one can use this to motivate usage as well as performance of the.
So just to answer, Sujay, ये monitoring एक ही one person is enough. वो meticulously करता है वहाँ पे बैठ के CDMA ऑफिस में, and CDMA the information goes to the DMA over the WhatsApp, where we are also part of it. A summary information is sent on every Tuesday, every Friday. CDMA need not come to the dashboard to micromanage it. The summary goes over WhatsApp. So it's a combined with WhatsApp monitoring also. But there is only one person, one individual. He does many other things, but meticulously monitors, alerts the municipality that they have to feed it on Tuesday. So morning of Tuesday, message is sent out to everybody. Morning of Friday, message is sent out to everybody. So that's how I think it is not a very elaborate control room. This one individual sits in his office and then monitors it very meticulously.
Very interesting. Achha, one more thing, Dr. Bhattacharya.
Yeah.
If there is any latrine which requires improvement, can you drill down to that one?
Absolutely.
There will be a few, na?
पानी नहीं है, या लैट्रीन का कोई लैच खराब हो गया, या कोई हैंड वहाँ पे हैंड वॉशिंग का लिक्विड नहीं है, वो भी can drill down. Jyotsna, you can.
So just to add, sir. So whenever they are doing the review, the sanitary inspector, the details can also be seen on the dashboard. Like this particular toilet has been reviewed on 17th August and the rating is good. So if the rating says like orange, like needs improvement, then the official can see which is missing. Like here we can see like this toilet is good in terms of all the facilities. So if there is a no at any point, then the official can see that what is missing in the toilet. And also they can see the photographs of the toilets clicked every Tuesday and every Friday. So there's a little blurred out.
So they can see whether the soap is available, uska mug or hand wash ka facility hai ki nahi. So photograph evidence is mandatory.
That will be updated every time.
Every time,
Yes.
every Tuesday and Friday.
Oh, great.
So just a point to Ms. Kaushiki, she would understand that it is quite challenging to hold on to all the photographic memory. So server space is becoming an issue, and we are trying to figure out how to do, maybe we can delete some photographs and how to deal with that. We try.
Maybe the older photos can go more than 1 month.
Yeah, that's what we're trying to figure out. So some system.
I see Kaushiki ji ka hand.
Yeah, thanks, Dr. Chari, Dr. Manini. Just a reflection, because, you know, we have been going through, I mean, all the other session, and it's just that this is such a huge sort of like, you know, structure, because then, you know, there is monitoring that requires to be done at the household level. So like, you know, how do we integrate that? Then second part is like, you know, the entire FSM supply chain along with these desludging people, like, you know, what exactly are they doing? How many times they are actually like, you know, sort of going and desludging, kind of training that they're receiving. So a bit of like, you know, process monitoring, to some extent output monitoring requires to be done at that FSM, like, you know, in between ULB level, and then going to these FSTPs, or maybe if there is a sewage treatment plant, then there are specific monitoring indicators. So it's just that the whole thing is like, you know, so huge, and there are compartments to it. So I think we were like, you know, really grappling with the idea, how can it kind of get integrated? Any thought on that? Like, you know, do we really need, for a person, if I'm a commissioner of a particular municipal corporation sitting here, to what extent I would want to see all of these, or is it okay to see all these in disjoint matters and specific people seeing it, and then they're all working in their own, like, you know, particular output? So this is a question that has been coming, and yeah, not really sure, but just a reflection. Any comment on that would be helpful.
Yeah, my take on this is pretty simple, Kaushiki, is I think we need to build gradually, module by module, because we also experience similar challenge. If I go to the household level from a FSM standpoint, complete desludging, har ek truck ka monitoring karna hai, so it becomes a little, especially statewide karna hai, to काफी challenging hai. I would suggest that we start in a modular fashion. For example, we started with PT, then we integrated with a customer feedback mechanism. Now we are integrating FSM. So along the value chain, IT enablement is done, and they're all seamlessly integrated. So my sense is it is always good to go modular, gain experience, and then scale up. That's, I think, is our limited experience.
So, Professor Chari, in the interest of time, I'm going to ask you to now share your presentation, and the questions related to your presentation, I'll request everyone to please put in the chat box, and sir will respond afterwards. Because we have the other speakers already there, we are already running short on time. So, Professor, can you please start?
So this presentation is basically another initiative that you know, it's again an ICT-based monitoring system with regard to the containments. Containment in this case is a septic tank or on-site system. I think everybody agrees, and we have discussed at length in the past, that if we don't design the containment systems right, then it is not delivering the desired outcome, which is about treatment, and then wastewater or the fecal waste from the on-site system will be going directly into the nalas and drains. So this is one aspect which is bothering us, and hence we thought it would be much more smarter if we IT enablement it. And here we are not talking about the legacy toilets which are already built, but the toilets that are going to come up in the future. So I will take you through quickly, given the time limit. As all of us know that we follow what is called a IS code of practice, Bureau of Indian Standard Code of Practice for building the containment systems. And unfortunately, it is totally unregulated right now. And it is left to the masons, and there is no inspection like in other countries. Every toilet is inspected. We saw in Japan, like Jacosa systems, they have not only inspection during the construction, but they have 4-time inspection with regard to performance. हमारे पास ऐसे छोड़ देते हैं, so it becomes an individual problem, and there are no clear guidelines given in terms of क्या size होना चाहिए, what is the expected population in your house, and accordingly what should be the size of the septic tanks, and what should be the size of the the soak pits. All these are not discussed extensively, and we have had these conversations in the past. Now, before the damage gets done, retrofitting, as we discussed, is going to be a painful process. So at least जो आगे toilets build होने वाले हैं, आगे जो आबादी बढ़ेगी, घर बनेगा, उसमें तो हम सही ढंग से toilets को build करना चाहिए. And how do we do it? Now, as I said, we follow very strict, we follow IS 2470, which is also part of the CPHO manual. Now, this guidelines, IS 2470, we have seen that हम 100% सर्वे किया था, एक टाउन में हम काम कर रहे हैं, वहां पे जो है less than 40% of the households are complying with it. It means it is nothing but ये toilet नहीं है, containment system नहीं है, it is not an anaerobic digester, it is just a pass-through chamber, which is dangerous. So what we did, we integrated this toilet design in the building approval process. As you know, as part of the Amrut, as part of the smart city, as well as part of the the reforms, the building approval systems are automated. इसको बोलते हैं auto development control regulation system. So there is a software, many states, of course, Andhra and Telangana and couple of states have started. Pune has started much before many states, where the architect will load the building plan. The software will check whether the building plan is complying with the building bylaws, and it issues no objection certificate within 5 minutes. Now, this is a big reform for a citizen. Now, otherwise, a building approval takes a lot of corruption issues are involved, a lot of visits are involved, a lot of delays are involved. So these software related issues are has been initiated right from JNNURM days. उतना ज़्यादा pickup नहीं हुआ, मगर under Amrut and other reforms, this has been scaled up very, very fast in many states. What government of Telangana did was to integrate the toilet design as part of the development permission management system. जब आप building को permission दे रहे हैं based on the checks and balances as given in the building bylaws, setback कितना होना चाहिए, उसका what should be the height, what should be the, where should be the fire exit, all these are automated as per the building plan approval. Now, why can't we automate a toilet construction as per the IS code in the software? So all we did was to work with the software developers and put in a place wherein the system will automatically check whether the toilet infrastructure exists, number one. Number two, whether it exists with correct dimensions, length, breadth, height, depth, पूरा वो check करता है automatically. And if it is as per the guidelines, as per IS 2470, it gives clearance. So this is basically an automatic check of the toilet infrastructure, and this has been put in place. Now, the town planning officer can go later as part of the validation process to check whether it has been built or not, and then occupancy certificate is issued. So it's a self-regulation to begin with. but followed by validation by the town planning officer along with other building related infrastructure. So a mobile app which is already there has been extended, and these checks and balances are integrated with regard to sanitation. So what the software does is capture the toilet details, and then it scrutinizes the drawing whether this toilet has been provided properly or not, and then followed by site inspection. So this has been standardized and this has been mainstream right now. So just to give you an example, हम ये data देते हैं, whether it is a residential or a commercial. Residential may be apartment say a lodging room, based on the IS code it has been designed. Then we take the area of the property. If the area is about 10,000 square meters, then provision of STP, decentralized package STP, is mandatory. If it is below 10,000 square meters, then on-site sanitation is required. Now, when on-site sanitation is required, the system is asking, kitne log ghar mein rehte hain? How many people are there in the house? And how frequently the desludging practices they intend to do. Accordingly, the dimensions are decided by the software and checks whether the builder or the owner of the property who is coming up for approval, whether they have provided adequately or not. Now, this is just to give you the metrics. Number of users, 5 log hai to minimum 1.5 meter hona chahiye, 0.75 meter breadth hona chahiye, depth will be 1 meter. Now, if it is a private dwelling, if it is a lodging or a rooming or a little bigger property, then the number of users increases as well as the dimensions of the sanitation infrastructure has to improve to meet the requirements. This is not what we have designed. We have taken the codes but integrated in the software so that the software checks whenever a household or a builder comes for approval, and then it issues no objection certificate. So whether it is a twin pit or a commercial property or jo bhi hai, it automatically checks and then it approves or it rejects. For example, हम input parameter ये लेते हैं, type of property, aerial, extent of the property, number of users, frequency of desludging, and CAD drawing. So the system automatically checks it, checks both superstructure as well as substructure, and issues no objection certificate. ये पूरा होने के बाद, when the construction begins, the town planning officer visits, site inspection hota hai, 2 बार site inspection hota hai, at the time of construction and finally at the time of occupation. Both the times these are checked whether it is complying with the design standards as agreed by the household, and then occupation certificate is given. Now these are the checklists. क्या check करना चाहिए when site inspection में जब town planning officer जाता है, और occupation certificate में क्या check करना चाहिए, और all these are automatically checked by which is codified in the mobile app, which is a part of the regular inspection of the building, but on top of it, sanitation infrastructure is also validated. So all I am saying is again that this doesn't cost anything, be it Madhya Pradesh, be it Jharkhand, be it Assam or Maharashtra, jahan pe bhi ho, this auto DCR application is already in place. All I request all of you to do, and wherever it is possible, is to work with the concerned town planning department, integrate the sanitation component in that particular building plan approval, so that when a building is approved or a property is approved for construction, it is complying with the IS 2470 standards, rather than randomly building the septic tanks without any consideration in terms of how many people are likely to stay in the property, what should be the length, width, breadth. ये पूरा consideration बिना approval होना नहीं चाहिए. So that's all. This application is very, very simple. It took less than a week to modify all this. So that's all, Dr. Mali, I thought I will share with you.
Thank you, Professor Chari. Unfortunately, we don't
you
have
please
time.
circulate. हम कर लेंगे ये PPT. We can take up some Q&A. If there are any Q&A, I'll address on the chat.
There are some questions, Professor Chari. I've made an attempt, but please do look up the chat box and respond. After our presentations of the next
Please
set,
go on.
we will also keep it open. Thank you very much. And thank you, everyone. And join me in welcoming Ms. Kuhn and Mr. Ram from Athena. Apologies, Kuhn and Ram, for this slight delay. They have been working diligently and very, very patiently with all the CWIS towns and partners and helping them in understanding the importance of developing robust indicators. They work with CWIS cities across the globe and have been instrumental in monitoring and learning systems and evaluation systems. So with those few words, I'll request Ram and Kun to take over.
Thank you, ma'am. Good evening, everyone. I think I have met a few of the participants over here. But then today I am joined with my colleague, Quinn Zhang, who is also supporting us, who is leading the CWIS monitoring and evaluation initiative across the cities, across the CWIS cities in Asia, South Asia, and Africa. And we'll be sharing some of the learnings, including some of the indicators that we have been tracking across these cities. And I mean, like when we talk, I mean, like I think over the past few months, you all have been hearing about the CWIS framework. Now, today's session, we will just take it a bit further and just try to understand what do we measure and what kind of what do we measure by across the value chain, across the different the CWIS components, the CWIS framework components, to understand whether a city is delivering inclusive services or not. And for this session, what we will do is we'll get to set the context. We will just talk about briefly about the kind of data that is required for sanitation planning and management. And also going back to the previous session on shit flow diagram and the FSM toolbox that we talked about, and the kind of data that we are capturing over there. We will see how those data can be collected from what sources and what are the use cases of these data points, the types of data that is required for effectively planning citywide sanitation infrastructures. And what we also want to show that is, given the, I mean, like we will talk about the CWIS monitoring framework on one hand, but then we also want to understand that the current sanitation data ecosystem, which is currently existing in the Indian ecosystem, be it Swachh Sarvekshan, be it SL service level benchmarks or SAN benchmarks. So we will also see the current existing data ecosystem that is available. And then we will try to also map that what additional information is required for tracking the CWIS initiatives. And if at all that additional effort is required, what does that effort look like? And we will share some of the CWIS the data challenges that we have been facing while collecting data from these 8 towns, the 8 CWIS towns. And finally, we will close by giving an overview of the CWIS dashboard and how the data looks across the cities on the dashboard. So that's what we are planning to do in this session. So just to start, the basic types of data, and I'll not, given that we have only limited time amount, I'll not go into the details of it, but then just to give you an understanding that we need the basic statistics from for a particular city or a particular catchment area. We need to understand the geographical data in terms of the administrative boundary, the source of water, groundwater depth, other things. We need to understand the demographic data, the sanitation situation. We also need to understand the policy and the regulatory environment under which the cities deliver the services, as well as the private sector demand, the market scenario across the cities. And usually we depend on 2 types of data sources. One is a secondary, one is a primary source of data points. Use cases of these data, so we can use it for understanding the ground situation, identification of gaps, decision making in terms of measuring what is currently happening and what kind of initiatives or interventions can be taken in place. And looking at the sanitation data ecosystem in the current, in India, so we have, so currently there are several cities are already collecting data. I mean, like, apart from, there are also these interventions which Professor Chari and in the previous session that were discussed. But then in addition to these, all the cities, they do collect data across these, if not all the 4 mentioned over here, they will definitely collect data on Swachh Sarvekshan, on the SBM MIS, plus or minus the service level benchmarks or the SAN benchmarks, depending on the city's ecosystem. So we have the service level benchmarks, which is like looking at 28 or 30 key performance indicators across different sectors, and particularly 9 indicators for sanitation. Cities often used to, in case they want to access the 15th Finance Commission grants or the performance grant linked under Finance Commission devolution from the state and from the center, they have to report on the service level benchmarks. So there is already, so the point of showing these data sets is that these data sets is already available with the city, and how they can use these data sets to better inform their decision. We have the SAN benchmarks, which is an extended version of the service level benchmarks, particularly focusing on the non-sewer sanitation bit. Cities definitely report on the Swachh Bharat Mission MIS, so they will already have information with respect to the toilets coming up in the cities, and then definitely looking at Swachh Sarvekshan, what kind of across over the years, what kind of data related to fecal sludge management and non-sewer sanitation is being captured under Swachh Sarvekshan is another additional point that the cities are currently capturing. However, so the question is, why do we need a CWIS monitoring system in place, right? If the cities are already collecting so much data, do we need an additional monitoring system in place? And in addition to these, there are additional state level initiatives which the states are anchoring, be it the performance assessment system, or be it individual states have their own MIS, state MIS, which they are also helping to, and tracking what is happening across the state ULBs, as we also saw in the previous session. However, one of the key concerns that we have seen, and particularly from the CWIS framework's point of view, there are certain gaps which still remain. Like for example, the Swachh Bharat Mission and Swachh Sarvekshan, they do not, they focus on the sanitation access primarily and not looking beyond the sanitation access across the whole chain. Be desludging is happening, at what interval desludging is happening, whether it is happening manually or whether the desludging is happening in terms of by mechanical desludging, or what is the safety of the sanitation workers. Sanitation workers, when we are talking about inclusivity, safety of the sanitation workers, or equity aspects. So those are some things that are essentially missing from all of these. When we looked at all of these 4 frameworks, those were things or components which were missing from these, and these gaps were existing across these data sets. And very few indicators, and it is also very important to understand that when we are monitoring, essentially or traditionally what we have been monitoring is the infrastructural assets which are established in a city or which are present in a city environment. However, it is very important to understand that the regulatory and the enabling environment, the policy, the financial support, the functions which are in place to deliver on those, on the outcomes, on the safety outcomes or the equity outcomes, it is very important to also look at them, because it's like a lever, and the governance at the city level works on a basis of these levers, right? So if all is not placed, particularly the enabling environment, it is very important to also monitor and track the enabling environment to efficiently and to deliver inclusive services across the city. And that is where the CWIS framework comes into picture. We'll not go into the details of the framework. I think there have been a lot of sessions which have talked about the framework. So we have, however, it is very important to discuss about these 3 or the 2 by 3, the outcomes and the function components, because the indicators are looking at or organized by these heads. So we have at the level of outcomes. So we'll have the outcome in terms of the sanitation service should be equitable, should be safe, should help in and should be sustainable in the long term, financially viable. And in order to deliver the equitable and safely and sustainable sanitation services, we need to have a core set of responsibilities outlined, and the mandate should be outlined in one at the ULB level as well as at the state level as well. So there should be state level acts which should guide the ULB to perform in a certain or to carry out certain activities. There should be an accountability system. When we are talking about the indicators, there should be a MIS or a KPI system, performance indicators, which should hold the cities who are essentially delivering the service. The cities should be accountable to a higher level authority, in this case, the state urban development department in most of the states. And there should be an accountability or a monitoring mechanism which holds the city accountable across the performance of sanitation services. And eventually, the function should also be looking at the resource management and planning aspects at the city level, as well as at the state level, whether the state funding is devolved or the state funding is devolved to the cities based on a plan that the city has, or is it looking at the needs assessment for at the city level? So it is very important that we look at the functions as well. So just to also, just to give you an overview, so like going back to the couple of slides back where we talked about all of these four national level data sets that currently we are tracking across all the states. One question arises, right? Is CWIS a very new approach? And just to look at that, we want to also bring your focus to the NUSP that was there. And there are currently also talks to understand how the NUSP can be revised and updated as well. But in the existing NUSP as well, all the components of CWIS, they do exist. If you're looking at equity, they do talk about equity, including everyone, urban poor communities, informal settlements should get access to the affordable and safe sanitation. It talks about safety. It does talk about sustainability as well. Responsibility, yes, it does clearly state that the ULBs are responsible to deliver the services. It does talk about accountability mechanisms as well as resource planning and management as well. So if you see this, then it's very clear that the CWIS is not a new approach, right? And why am I saying this is it is very important for us to understand when we say that CWIS city, we are talking about 8 CWIS city, or we are going to talk about 8 CWIS cities. CWIS is not a certification mechanism. It's a approach through which you actually look at inclusivity and how the city is delivering the services. So also, and it is important for us to understand that if you look at the investment, the current investment that is happening, and this is one study which was done by World Bank recently, it looked at that the annual investment that is required is $120 billion to achieve SDG 6. Whereas the subsidy itself is much higher than what is required. So the subsidy is going at $290 billion. But however, $160 billion is targeted towards the wealthiest population, and only 6% is targeted towards the 20% of the poorest population. So this shows that there is such a huge lack of, when we are delivering services, or when we are allocating funds to deliver services, there is so much of inequity in the distribution of the funds. So existing subsidies are there, but highly inequitably distributed. And so essentially what we're trying to say here is the language is already there, but then the goals or the actions that we have seen across countries, across states, across regions, it has not translated into into the equitable distribution of sanitation services. And that is where we have to specifically call out the equity aspects and monitor and track them. So that brings me to what do we track across these across the different outcomes. And we'll be looking at equity. When I'm talking about equity, so particularly we are looking at, so I'll not go into the details of the indicators. I think the indicator list has already been shared with all of you. There's a measurement note which was shared. So please feel free to look at the indicators, and you will be able to understand what we are trying to track across the equity, safety, and sustainability. But I will give you some examples to give you an overall understanding of what we mean or what we are trying to track, and by what means of data sources can we track them. So for example, in equity, we are looking at be it gender pay gap, how much across the sanitation workforce, whether the gender pay is equitable across the male and the female population or not. We are looking at sanitation workers equity. Do they have the legal right to formalize and make a union and voice out their voice out their opinions or not? they are having social security, or they are having health insurance and the social security or not. So these are things we are looking at from an equity perspective or an equity lens. Under safety, we are looking at whether it's safely managed or not across the citywide, and I'll come to how we are tracking or how we are measuring safety across the cities or not in a while. We are looking at whether there is across the different categories of institutions, be it educational, be it healthcare facilities, be it the household level. We are trying to understand what is the percentage safely managed sanitation or not. And this is something that we are going back to the SFD's definition of safely managed. In the SFD, last time my colleague, he explained how the green arrow indicates that it is safely managed, and the fecal sludge generated or the wastewater generated is safely managed, and how the red indicates the wastewater or the fecal sludge which is not safely managed. So here, the safely managed definition that we are using is the SFD definition. And all the 8 cities that we are tracking data on, we are tracking it based on the SFD matrix that we have, that is there in the open in the public forum as well. We are trying to also understand the percentage of desludging services which are completed mechanically or manually done. Trying to understand whether there's also a bit of public health aspect which is there in the safety indicators as well. We are trying to understand whether the fecal oral pathway diseases, what is that incidence of those diseases per thousand cases registered at the local municipal hospitals. So we are also looking at the sanitation worker safety. Suppose in a month, this many number of services are provided. Out of them, how many services were provided where the sanitation workers were wearing or using the PPE gears, whether it is regularly monitored or not, whether they have health checkups or not, government funded health checkups or not, and how many of them are attending those health checkups. And in the sustainability, we are looking at the percentage of treated fecal sludge and the wastewater that is reused, and the operational cost that is recovered from the sale of treatment. Like it can be from anything. It can be any of the revenues that the city is generating for sanitation, be it the sale of wastewater, be the sale of reused compost, or be the user fees. How much of the operational cost is getting recovered, and eventually we're looking at the capital investment that is either covered by government transfers, or what is the source of the capital investment that is coming in. So these are few aspects that we are looking at when we are trying to track the performance outcomes. And in terms of the functions, so the functions, as I already mentioned, these functions are tracked at the national, at the state level, as well as at the city level. So at the national level, at the state level, we are trying to understand whether there is a legal mandate which is clearly specifying that who is responsible to deliver the services and the inclusive services. And the approved, I mean, like at the local service authority level, whether there are positions, I mean, like whether the positions are all filled or not with respect to, are there enough, or is there any guidance with respect to the positions that is being set up by the state level organogram, like the state level urban development department prescribing an organogram through which the city level authorities are filling up the positions or not, and whether it's sufficient to manage the city level service delivery or not. At the city, and a mirror replica of these state level or the national level mandate related or responsibility related indicators is being tracked at the city level as well, in terms of whether the mandated authority is actually delivering that services or not. So it's like look from a perspective of enforcement of the mandates and the roles and responsibilities which have already been mentioned in the state level municipalities act, or in a policy or a guideline that is there. And so we are looking at whether the local service authority, the staff positions are filled and capable to deliver the services or not. And all of these indicators are just the primary level indicators. There is also a sub-level indicators as well, where we also break it down further to also understand that when we are talking about capable of executing a mandate or not, we are also looking at how often they are attending the training workshops, whether there is enough capacity or there is enough capacity building initiatives for the local city level municipal officials or not. We are looking at accountability, as I was mentioning about accountability, where there is a performance indicators are monitored and set and defined at the state level or not. And at the city level, we are looking at whether the cities are reporting on those performance indicators or not, whether they are actively reporting. We are also looking at whether the incentives or the penalties are actively used and applied by the state level, or the state is enforcing it on the ULBs if there is not regular monitoring and reporting happening at the city level, and the city level is not reporting data or is not reporting data on the performance metrics or not. And we also, at the resource planning and management level, we are looking at whether there's a clear financing framework which is available at the state level to guide the distribution of funds to the city level. And at the city level, we are trying to understand whether the budget that they are developing, whether that budget is informed by the needs assessment or not. What kind of whether there is an integrated citywide sanitation strategy which informs the budgeting or not. The budget allocation is transparent, is inclusive. When we're talking about inclusive, we are looking at whether the budget has a special provision of delivering services to the poor, to the urban slums, to the vulnerable group, whether there's a specific budget for gender or not. So those are the inclusive services that we are looking at. And those are the sub-indicators to these primary indicators which we are covering right now. And just giving an example over here, right? I mean, like just looking at the safety indicator, if you're talking about the percentage collected FS disposed at the treatment plant or designated at the disposal site, what kind of what kind of data points do we need for this reporting on this indicator? So the data point that we are trying to track over here is the volume of collected FS that is disposed at the treatment plant and the total volume of FS that is collected. Now, the total volume of FS that is collected can come from the estimation of the containment data, and also like the Fsm Tracker, like for example, in the case of AP and Telangana, some of the cities are implementing that. So the Fsm Tracker also helps you understand how much of volume of FS is collected. And the FSTP logbook or the weighing scale, the weighing bridge at the FSTP will help you understand how much is volume of FS is getting disposed at the treatment plant. So these are few sources, examples of few sources which helps us understand the data, the kind of data that we require, and the data is being reported from these sources. And all of these sources have been mentioned in that document that we have shared. So I'll not go into the details of all of them. Just to give you another example of a equity indicator. So we are looking at sanitation workers equity, right? And one of the things that we talked about was the percentage of sanitation workers who are covered by social security and health insurance, whether there's the presence of workers union or not, and whether there's a legal channel for them to in case of any grievance or in case of any issues that they are facing, whether there's a legal recourse or a channel for them to register a complaint or not. This can be taken from secondary data, government reports, or primary data in terms of having interviews with the key stakeholders at the ULB level. I'll not go into the details of all the indicators under responsibility. We have already covered them. But yes, as I was mentioning, that we are looking under responsibility, we are looking at the legal mandate, and at the city level, we are trying to understand whether the city is adhering to those legal mandates or not. Accountability, yes, if there are clear and progressive performance targets set at the national level, and whether the cities are reporting on it. Now, I would just draw your attention to the term used over here. What we mean by progressive targets is like, for example, service level benchmarks at the country level, it says that the benchmark is 100% for percentage households having access to safe sanitation infrastructure. However, we don't want, that's an ideal case scenario. We do not want the cities to start with, and also I think there was a question in the previous session that where do cities start with, right? And where Professor Chari was mentioning that it should be incremental. So it should not be that the cities should target for, and when we are talking about performance targets, cities should not be targeting or be over ambitious and target for 100% in the first year itself. It can be progressive. So, and what we are doing, and when Quinn shows the dashboard, you will also see that there's a trend line feature in the dashboard as well, which can actually help us tell that, yes, last year the target was 50%, and the city was able to achieve maybe 30% of it. And then the target has increased from 50% to 70%. So that's the progressive nature of targets that we are trying to look at. Yes, as I mentioned in the resource planning, we are looking at whether there's a clear financing framework which allows the cities to or the states to actually follow that framework and disburse funds across the cities. So a couple of things. So what I mean, like based on our experience on the across these 8 cities that we were tracking data on. So I mean, like not all. I mean, like sometimes it's a kind of a laundry list of all the indicators, but it's not feasible to collect for cities to collect or have collection systems on the on ground to generate data which can feed into those indicators. And so which indicators should a city start with? And some of the advanced set of indicators which the cities can take it up once the systems are in place and running for a couple of years, maybe. Like, for example, gender pay gap and the pay gap balance between female and male sanitation workforce is something which we have seen that it is not, the data is not available, and the data to track it and to address that gap is not there. Similarly, subsidy amount, how much of subsidy is being allocated towards non-sewer sanitation as compared to sewer sanitation. That is something that the data is not available usually across the cities that we have seen. Similarly, like diseases and the water contamination compliance in terms of how many samples is being tested and what percentage of samples are free of fecal coliform. So these are data sets which can be taken at an advanced stage as well. The others like safely managed sanitation, whether the woman in the sanitation, the municipality, be it the sanitation committee or be it the environmental department, whether they are whether what is the percentage of women representativeness in the representation in the decision-making bodies. So these are certain things which we feel that the cities can easily track and start tracking with if they want to understand where do they stand with respect to delivering CWIS services. And then the second thing is where can data be found? So as I was mentioning, the initial 4 data sets, right? I mean, like when we did a mapping of those data sets with the CWIS framework indicators, we saw that like more than 60% of the data already exists with the cities. It's just a matter of using the data to understand what can be tracked using the CWIS framework. So the data can already be fed into the CWIS. I mean, like a lot of the cities that we are tracking data from, be it Warangal, Narsapur, the other CWIS cities in India or outside of India, we are always depending on the existing set of data sets which are already available with the cities, so that the cities do not need to go out and generate new data sets from their own. Yeah, so that's the point on synergy. I'll end with like 3 challenges that we have seen. When we are defining these indicators, definition and standards, they vary across countries, across geographies, across, I mean, like, for example, the sustainable development, the SDG and the joint monitoring program, which helps us track our progress on SDG 6.2. There the definition of safe or safe toilet systems or sanitary toilet systems are completely different with what the countries are also using. We have seen that. So it is very important to align the definitions and if you want to compare, and and that is where we thought that while defining safe toilets for CWIS, we will follow the SFD approach. And for the second challenge that we have seen is the coverage and the representativeness of data sets. It is very important that the data that you collect in order to respond to a particular, particular indicator, the quality of the data should be as important as the representativeness of the data. If you have a data for a city level, the data is, you are reporting the data for a city level, but then you are looking at only like 3 or 4 wards of the city rather than looking at all the city, all the wards of the city. So then that data will lead to your decision making will not be as effective as or the interventions will not be as effective as the real case scenario. This is an example where we have seen the same thing happening in Lusaka, Zambia, where the data was reported. We saw the SFD data, which was looking at how much of households connected to pit or pit latrines it was reported as 64%, whereas the septic tanks, it was reported as 18%. And the same data, which was collected by the local water utility as well, it showed the complete opposite, where it showed 60% was connected to septic tanks and 14% was to pits. We dig a bit further and to understand what is the issue that is happening over here. So that the utility study that was conducted was only for 20 households, whereas whereas there are 10,000 thousands of households in that neighborhood. So it's a question of how representative your data is when you are reporting on these particular indicators. And one other thing, when all the cities are planning for FSM interventions or sanitation interventions, it is very important to plan it in certain way that there is compatibility between different data sets that you are tracking. For example, this is an example from Khulna in Bangladesh, which is also one of our CWIS focus cities, where we have seen that the city wants to implement sanitation tax, and they have already done a baseline survey, which was done a couple of years back. They have done a midline and an end line to understand the sanitation situation. But then all of these surveys were done. The unit of these surveys were the holding number, which is like the property number in our case in India. So the holding number was the unit for data collection across these surveys. Whereas now that they want to implement the sanitation tax, so the sanitation tax is linked to the holding tax ID, which is different from the holding number. So there is no unique identifier between these two data sets, and then now the city is having issues in implementing sanitation tax for that city. So it's very important when you are planning a data, when we are looking at the data ecosystem, to have comparability and compatibility between the data sets, so that in future when you are trying to implement any intervention, it becomes much more convenient for the cities to implement. I will hand over the session to my colleague Quinn, who will take you through the dashboard, and I'll request her to just share the screen and show the dashboard and show the indicators and the learning platform that we have on the dashboard.
Thank you, Ram, and thank you, everybody. So I will start sharing my screen of the dashboard. So is everybody able to see my screen? Okay.
Yes, we can.
Okay. So this is the main website, which has the monitoring framework that we talked about and also has the list of detailed indicators. The main indicators are actually available directly on the web page itself. And here is the methodology note, which was shared as a pre-reading before the last session on the SFD mechanism and the FSM monitoring tools. And so the detailed list of CWIS indicators can be downloaded here. So this includes not only the primary indicators and also the sub-indicators under each of these, which basically is based on the availability of the primary indicators. So in some of the cases, only if the training and certification is required, then we would go into questions such as, does the training cover labor rights and recourse? So you are welcome to take a look at the detailed list of indicators to understand more about how we are assessing this. And so the dashboard with all of the data for the 8 cities is currently only available to the cities in the cohort. So it is a closed dashboard for now, but there are plans for opening up this dashboard and also inviting more cities to join this dashboard. So as some of our cities who are represented in this cohort are going to have more data and have the assessments ready, then in the future, we would love to see your data also showing up on the dashboard as well. So just to give you a sample of how this dashboard is presented. So we have the quantitative and the qualitative indicators as well. So for the quantitative indicators, so for example, we would see, let me just minimize this. So for the quantitative indicators, you will be able to see how this city is comparing with all of the other cities, as well as seeing the raw data and the numbers that went into the calculation of this particular indicator. So then we also have the qualitative indicators, which would come with detailed narratives of what this what the actual scenario is on the ground. And for example, for some of these indicators, when it talks about the legal and regulatory parts, we would also reference the act and the legal documents that are there. So this is just to give you a flavor of what these indicators would look like. And additionally, there are some more learning documents from each of our cities to talk about what their experiences and learnings have been from this process and anything that they would have to share. So here you can filter for the cities. You can also filter for the topic areas that are associated with CWIS, for the value chain, and also for the types of learning outputs as well. So as we are short on time, I will just pause here and to open up for questions to see if anybody has any.
So please go ahead and ask any questions. I mean, although Poon and Ram have been actively responding, if you still have any questions, you may please ask. They have a hard stop at 7, so request you to please ask your question.
Yeah, hi Kun and Ram. So Sujoy here, this dashboard looks very interesting. So how does one become a part of this dashboard? Do we have to collect information in a particular format structure, or I mean, how does this work? Yeah, over.
Quinn, do you want to respond to that?
Sorry, I was on mute. So sure. So currently how we're collecting this for all of the CWIS cities is that we have a separate kind of data collection process for the quantitative and the qualitative indicators. So the quantitative indicators would come from the existing data that has been collected already by the city themselves. And so we have a detailed Excel sheet that basically maps out what are all of the constituent data points that should go into calculating that indicator. So then the cities would fill out the data sheet with whatever information they have collected. And then using this kind of standardized format, we would then be able to automatically calculate the indicator values for the quantitative ones. And for the qualitative ones, what we have done is to follow a combination of secondary research of the legal and regulatory documents that are in the public domain for any city and any country. And most of these would be at the national or at the state level. And then we also combine that with primary data collection, which are KIIs, the key informant interviews, with our key informants from each of these cities. So we are happy to share the quantitative data collection template that we have been using. And the qualitative KII guide is also something that we are going to publish on the website as well. So this is something that should come in like the next 2 months time. So like I said, that currently, while this is only open to the 8 CY cities and the dashboard itself has a private entry, but as more cities are having this kind of information, we are also actively in the process of planning and discussing how to open this up for cities to self-enter the data and to allow this dashboard to become something that's more open to everybody who could be interested.
Hi, can I just quickly comment? So I just have one question in terms of, so we tried internally, Ram, checking on the SFD dashboard. I mean, the thing that you showed us earlier. A couple of points we felt that maybe a bit of tweaking needs to be done here and there. So similarly on this line, on this particular, this framework, can we do a bit of tweaking again, like for both the platforms, basically?
So if I understand correctly, Kaushikiji, it's like you want to tweak the indicators that we are tracking right now?
Maybe some of the question as
Okay.
well, Ram. I think it's more on the input end that we felt that maybe a few questions needs to be added.
Yeah. So what, so what we have right now over here on the dashboard is something that we are tracking from a CWIS perspective. So there is no, this is what, and there have been a lot of discourse at the global level as well to understand what the indicators should be to track effectively the CWIS components. So from a CWIS perspective, at the global level, at the portfolio level of these 8 cities, there is currently the indicators are finalized and there is no scope for changing. However, as I mentioned, right, the CWIS is like it's an approach, right? And in one of our other programs as well, we are trying to understand, and all of these indicators, maybe not all of them are relevant for the government stakeholders, right? Maybe only a subset of it is relevant for the government stakeholders. So what I would suggest is to take this framework and the indicators as a guidance, as a reference point, and not to follow this absolutely. If you feel that the stakeholder, the city level stakeholder is not, or there is no, there is no appetite within the state government to implement some of these indicators right now, or you know that there is no system on at the ground level to generate data for some of the indicators, or you feel that there might be something else which the ULB official may be more willing to track and that is more beneficial for them. For example, like the CPHO guidelines, the IS code, whether the on-site systems are more adhering to the IS codes or not. That is very context specific to the Indian ecosystem. And where, and what my basics of the key takeaway here is like, we would suggest to use the CWIS framework as a reference point, but then not to implement and like track exactly what is mentioned in the platform here. Quinn, do you want to add something to that?
Sorry, just one additional question. So can you customize it? So suppose if we have to use a monitoring framework for 4 cities, say, can that be customized by you guys?
Oh, no, Kaushiki. So this is very specific to the program that we are implementing right now and the CWIS discourse at the global level. So right now there is no, there's no modification possible for this dashboard right now. But Quinn, do you want to add something to that as well?
So in terms of customizing the indicators, so I do get that maybe not all of the indicators would be as relevant or as useful to your city at this point. And that what we had in turn suggested was that maybe to start with some of the indicators where we already have the data and where data is readily available and that are also probably more relevant to where the city is at the current stage. So in terms of customization, so the intention behind the set of framework and this set of indicators is really that we it's meant as a indicator framework that is applicable across the globe, so that some of these indicators may not necessarily be exactly fitting to, for example, the Indian context or the Bangladeshi context, but it is designed because of our consultations with both of our partners in the South Asian context and also partners in other global cities, like in the African cities as well. So there's really no kind of customization that we're actually going to do for this kind of indicator. But if you have any specific suggestions as to if some of these indicators, you see there are things that don't currently consider your local context, then we would be happy to also consider that and to also improve this kind of global framework as well. Does that answer your question?
Yeah, thanks, Poonam. Yeah.
Mr. Pankaj, you would like to ask the question?
Yeah, my question was just connected to the earlier one, which actually Kaushiki asked, and probably Sujoy also wanted to mention it, is that, in terms of institutionalization, it seems as if this is very project-based. But, in terms of its institutionalization and use by the government counterparts, how successful is this? I mean, is it really happening? If it is really happening, how they are using this data in terms of, improving their overall CWIS process in terms of planning, managing, or monitoring, or maybe putting some systems for sustainability? Are they able to do it directly by themselves, not by a third party? So that is my question. If it is possible to do, yes or no, or it is happening at this particular moment, yes or no, and if there are any challenges in terms of doing it, what are those challenges? this will really help us if we really want to, put it in our interventions or continue, or maybe, at the later stage wanted to scale it up. Thank you.
So thank you for the question. So one of the main challenges, I think, to begin with, is that a lot of the cities currently do not collect enough data for actually being able to use a lot of the indicators in the framework. And that one thing we have also discovered is that while some of the cities do already collect a fair bit of data, the existing data points often have compatibility issues and interoperability issues with each other because of how each of the data sets were not planned out in a way that they can be linked to the other data sets. So one of our suggestions, just based on our learnings from these 8 cities, is that if the city has not yet collected a lot of sanitation data, one way to start is probably to look at what are all of the indicators at this point that the city is most interested in collecting with the limited resources that it has in terms of the outcomes. And then from there to see if I want to collect this set of indicators, what is a bare minimum that I need to achieve, and how do I make sure that each of the data sets can be linked to each other? So if we're collecting household level data in terms of the access and containment part, how can we make sure that there is a mechanism that links this to the emptying and conveyance part, which is usually tracked by another mechanism, like, for example, the Fsm Tracker that is being utilized in Warango and Narsapur. So there needs to be thoughts behind how to link the data that is being collected or is going to be collected, and I think that in that context, starting with the CWIS indicators, identifying which indicators the city is most interested in collecting at this stage would be the first step.
So I'm going to bring in Jyotsna here, because for both Narsapur and Warangal, she has been collecting the data for this exercise. So in terms of challenges faced or whether third party is doing it and all that, just a quick comment from Jyotsna and then followed by Prasichari. Prasichari, I see your hand up, so thank you.
So on the data collection part, like the ULB does collect information on the containment systems. It collects information as part of the SWAT surveillance. So we take those data, and also on the public toilet related, public and community toilets related, we do have app for the Telangana, and also for AP. They are using ULB level other monitoring system. So we take data from those platforms as well, and also if there is a requirement for any data collection, like a separate data collection, so it will be done by the ULB level itself. So maybe Charlie sir can add anything.
No,
Sanjay, are you trying to share something?
Hello.
Sanjay ji, your voice is not very clear.
Okay.
So, Prasichari.
Yes. So just to respond to, in fact, raise my hand in response to what Mr. Pankaj mentioned. I think right now, if you ask me whether this whole template has been institutionalized in a particular city or a state context, I would say it's too early. It's very, very early to do that. For the simple reason that this is a work in progress, and expecting them to track and monitor is a little more ambitious. But what is important, if I may say so, is to have this template with all the indicators in front of us and pick up relevant indicators by brick, building block by building block, and then move forward towards filling those indicators one by one. It's not possible, and it is not done. To be honest with you, even in states like Orissa, states like Telangana or Andhra or even Maharashtra, abhi hua nahi. But it is going step by step. So my sense is the ecosystem for data collection also abhi ban raha hai. For example, Safai Mitra challenge is enabling certain indicators to come. Pehle nahi tha. Similarly, this city rating system, sanitation rating system, that is also enabling some indicators, because some of these data points are also going in the national rating system. So I would say that the ecosystem for data building is happening, but concurrently we as professionals supporting cities and states, and also some of those are on the call, we can pick up the relevant indicators beyond financial outlays, beyond inputs, and start building step by step, and each city may like to pick up and choose maybe relevant indicators. For example, Orissa is now heavily focusing on worker safety, bridging the gap between the pay parity and related welfare related indicators, whereas some other state may be prioritizing a couple of other indicators. So my sense is, let us not expect all these indicators to be institutionalized within a municipality or at a state level, but go build step-by-step methods to take it forward, is what my response to. But this framework should be shared repeatedly, and we should be looking at this framework repeatedly, because unless and until we keep nudging governments and state and local level, the messages will not go. So I agree that we need to keep nudging and keep sharing these indicators and encourage states to build this system in place. Maybe Josna, the next toolkit, what we are doing is adapting what Athena has already done, customize it to our language, to our situation, and then start institutionalizing at the DMA level so that it becomes part and parcel. CWIS is just beginning in most of our states. It will take some time.
Alternately, as Ram had suggested and Kun had suggested, we could reach the elements of customization required, and they could also revisit and revise the tool if it is not needed. It'll be great learning for them and can be scaled up across. So it's quite clear that ICT is extremely important for monitoring, establishing monitoring systems. The templates, tools, frameworks are available. One can customize them. We'll be happy to extend some support. If there are any further questions, we will continue. Prasachai, can you also please look at the chat box once, just to see we have looked at all the questions. And I did see Mr. Sanjay trying to make an attempt to speak. Sanjay, would you like to come in and ask your question? Okay, so if there are any other questions, we could take them, and we can thank Ram and Kun for joining and staying beyond the time that they had planned to. Okay, thank you very much, Ram and Kun, for sharing these insights. And you would see a lot of members coming to the dashboard today and looking at it. If required, we could, we could see how we could read some feedback from our participants to you, and we could take the discussion forward. So thank you once again. And yeah, Kaushikiji, we will send it to you. This information we have, and Ram and Kun also work very closely with the ASCII team. So all these indicators, whatever are there in the chat box, we'll be very happy to reach it to you.
Thank you. Thank you, everyone.
Thank you, everyone. Prasachari, any concluding words?
No, thank you.
Yeah. All right. So thank you, everyone, and catch up soon. Have a great week forward.